testimony.
Okay. Very interesting in that you have several symptoms, but the biggest one that you seem to be talking about is like a ball-pean hammer right here in this location. Here you can see the left vertebral artery, you can see the right vertebral artery, and it's not too difficult to see that this atlas is digging, actually it's interception is a word, into the skull there. And here the skull is making contact with the vertebral artery, so this vertebral artery is inflamed, and I think that's what's giving you the trouble. Obviously there's also an occipital nerve that comes through here, and other structures that will swell up. But the biggest, the most demonstrable thing here is how the atlas is digging into the skull. And then when you turn your head to the right, you can see how it really does slide up in there and dig in there even further. It just kind of sucks up into the skull. And then when you turn your head to the left, even more, you can see how it, actually I can probably get that a little better. The atlas slides up towards there and even really approximating that vertebral artery. So you can see how there's no room there. And this is from repetitive injuries and mannerisms and auto accidents, and then after you had the surgical fusion, most of the motion is occurring at the cervical cranial junction. So you have the fusion between C3 down to C5, and we already found from this motion study that your C2 is fused to your C3 basically. This joint capsule is not moving no matter what you do. So really the only person that's moving at work is this one right here. You had 7 people go to work, all 6 of them are injured. Now you have 1 doing all the job of motion, and that's basically what's happening is he's gotten worn out too. A couple other things here. Just looking at you in the neutral position, your left shoulder's up. Your levator scapula is going to be contracted and pulling this over. As a matter of fact, somehow looks more demonstrable from the front. So here you can see that shoulder up, and the cervical spine is being pulled towards it by a contracted levator scapula. Whatever you got to do to get that thing to release. We'll bring that back around. So when you turn your head to the left, it stays up. That left shoulder stays up, and when you turn your head to the right shoulder goes up. There you go. Because of the fusion, all your movement is at the top of the neck and the bottom of the neck. Now the other thing here is we found all these adhesions in the front of your neck. So there is some adhesions pulling this internal carotid, actually the common carotid this way. We have a vertebral artery back in here being pulled towards the midline. We have the internal carotids up here being pulled towards the midline, here and here. You really did like it today when we released some of the scar tissue, or tried to break that up, particularly this one and that one. We didn't go after these today. What else? Actually, there was more, but there's more. So when we go inside the cranial vault, we did find an arachnoid granulation decreasing venous outflow from the right side. But as far as venous compromise, that's the only thing you have. So one compromise typically is not enough. Here we have left rotation, checking to see how far your atlas slides off of C2. It's a little too much. Same thing there. And the rest of the vertebrae don't seem to be moving. There's a little joint movement there. Again, left rotation. What else we got? A beautiful shot of how much it tucks up into your skull, causing that artery to be inflamed. Another good shot of it. Left rotation, right rotation. Again, look how much of a distortion you have there. Structure affects function. It doesn't like to be distorted, as crooked as a dog's hind leg. There's that pinched vertebral artery. Again, left shoulder up, and right shoulder goes up when you turn. good shot of those contractures. Another one. Actually, this is one. There's about 4 in there. Okay, and now we get to how your skull rocks over. Let's go. Show how the skull rocks over. So here in the neutral position, your skull is rocked over and you have an acute angle. We did the atlas orthogonal measurement, and it's your atlas is up to the right, the skull is rocked over, and it's actually making contact with the odontic process of C2. And then if we look over here and deconstruct you, we can see when you turn your head to the left, it continues to stay pretty much bottomed out there. But when you turn your head to the right, it goes all the way to the other side. All the way to the other side. Here you can see how the skull rocks over. So how much instability do you have? We're going to obviously do some bracing, send you to some doctors who will evaluate that and do some PRP and Prolo and maybe some other procedures to stabilize that. Obviously we care about getting your atlas adjusted. And when we picked up on your head, just take the weight of your head off your neck. You got a lot of relief too. So bracing is going to be helpful to us. Any questions, anything else that you can think of?
Not at the moment.
All right, let me make sure I got everything. There's your levator scapula where it attaches to C1, 2, 3, 4. That could be pulling over. We did find the first rib drop down on the right, and the middle and posterior scalenes attached to the upper cervical spine there, and they don't like that either. That's in play. Another shot of that first rib down. Okay, here we did the alignment. We drew a line through the foramen magnum. There's the atlas rotated. Another shot of it. C2 is rotated too. There's your airway. Another picture of your airway, some narrowing in there. Again, these contractures pulling your carotids and vertebral artery sideways. And there are nerves, there's a plexus of nerves around these arteries, so they don't like it either. Just the autonomic nervous system doesn't like it. That was the biggest piece of scar tissue we broke loose today. There it is again. Another view of it, how acute that angle is. Yeah, there's that common carotid plexus that's around the carotid, so it doesn't like being pulled and distorted by scar tissues or anything. You can get kind of an autonomic nervous system freak out. All right.